And for the lumbar spine, probably some of the common techniques that are offered are stretching techniques. Stretching techniques, you know, they're very, very useful. The American Council for Exercise sort of include some of the effects of stretching to include increased range of motion, reduced muscle stiffness, decreased risk of injury, the sort of relief of post-exercise pain, and improved posture even. I would query how much the increased posture or improved posture is affected, but it does have an effect. Reduced muscular cramps and tension, and that can lead to sort of muscle relaxation and thus reduced stress. The sort of improved mechanical efficiency and functional performance of muscles. The preparation of a body for exercise, or the improved in promotion of circulation, and in this case decreased back pain. So that there's some of the sort of physical effects that are mentioned by the American Council for Exercise. There are various techniques for the lumbar spine. One technique could just be basically rolling the hips from one side or to the other side and getting a nice stretch on the erector spinae, quadratus lumborum. Another technique, which is quite nice, comes from sort of Feldenkrais teachings. So basically, they're stabilizing the top half of the thorax by putting the arm out and then rolling the hips and the knees over to the side, and they hold that stretch, and they'll feel a good stretch along that side. I'm going to show you this on the other side now. So we bring the arm down, take the arm out, and you can see this area nicely lengthened. One should hold any stretch for at least 30 seconds to 1 minute to have any sort of real effect or any sort of real benefit from it. We can also do the same exercise with both arms outstretched to the side, again rolling down to the side and rolling to the other side. Can be quite effective as well. Another stretch is the Piriformis stretch. If we just get the model to let their arm down, and in the Piriformis stretch, they're basically going to do like a kind of figure of 4. So we'll show you on both sides. We'll take the leg over to this side. Now, the patient will try and pull this portion up, stretching here, but the problem is they're going to drop out into abduction here. So sometimes it's easier if they can do it with a partner, and the partner will hold them there, and then they pull up, and you can feel a lot more stretch there. It's pretty hard to do that by yourself, but it's one of those very useful stretches. We'll do it on the other side now. So just take the leg down, figure of 4. They're going to pull up. You'll watch the leg will come over, but a partner could come along and just hold the leg in, and the patient or model feels the stretch considerably in the piriformis. There are various techniques for the hamstrings that we can use. One way of doing a hamstring stretch is actually getting the patient to kind of stand up, and that often is actually very close to doing a slump. If one looks at the hamstrings and their attachment, if I get the patient to sit up, and you're going to sit with your legs along the bed, and just bend your knees, sorry. Now, just bend that knee as well. What's going to happen is you can see this lumbar spine is curved here. But the attachment of the hamstrings, if we want to stretch the hamstrings, if we can get the patient to either sit up against something solid and hold their back, and now lower your legs, just lower your legs without having any pelvic tilt. And this is a very, very flexible model, and she's feeling a hamstring stretching there rather than the sciatic nerve. The other way of stretching it is sometimes to actually bend forwards and stretch like this. Somebody like this is very, very flexible. Their hips are tilting anteriorly, and she's actually probably more stretching a sciatic nerve than she is her hamstrings. So that's one way of stretching the hamstrings. The other way is the more common way, which they do in standing, which is similar to a slump. So that's one way of stretching, a good way of stretching the hamstrings and really focusing on the hamstrings rather than just standing. Another general spinal stretch is if I can get the patient to turn onto all fours into standing on the 4-point kneeling. So we've now got the patient on all fours. In some societies they call it being on all sixes because they count the feet. But we will talk about all fours. This can be a really good exercise, as you will recognize it, some of you that do yoga, for actually mobilizing the whole of the spine as well as stretching the spine. As a stretch, one would just basically arch the back, drop the head, drop the shoulders, and basically stretch. But then if they come backwards and forwards, they're actually mobilizing the whole of the spine, from the lumbar spine, the thoracic spine, and the neck. And this is a really good mobilized exercise. But if one wants to just stretch, we would just hold this stretch here, and even maybe go back, dropping the hips and the buttocks back towards their heels, and then coming back into that position. But it's a nice mobilizing exercise as well, which kind of leads us nicely into some of the mobilizing exercises we can do. We can do, as we said, this sort of mobility exercises, but we can also do various other mobility exercises similar to the Feldenkrais movement, but just including that and repeating it several times. Another exercise would be to possibly just get the patient to rock all the way back, as we said, dropping into the and coming forwards, and in actual fact lying down and going into a Mackenzie kind of extension, and coming back and coming right down and holding themselves there. And if they can, this is too difficult for them, they can actually lay on their stomach and extend their back. And as I said, do this Mackenzie extension, which is very good for disc problems, but it has to be sustained rather than moved. So this is very useful technique for mobilizing as well as stretching. Some other ways of mobilizing the lumbar spine include the Feldenkrais roll, which we're going to show again, and lumbar and thoracic mobility exercises. Another, maybe it's a semi-Feldenkrais type mobility exercise that can also be used for stretching, is in this 4-point kneeling position. We get the model or the patient to pop their arm behind their back, lifting their arm up behind their back, and they're basically going to twist, and this way they're really stretching and mobilizing in here. Sometimes if you sustain it, that's going to be the stretch part, but if you continue to do it and do it a few times repeatedly, fairly quick, that's going to be the mobilizing part of it. We'll do it on the other side with the other hand, and down, and again, and relax. And you could then add in again a rocking backwards and forwards and stretching out the spine, so you've stretched on the sides and then you're doing it bilaterally. One other stretch that we can now look into is the side stretch. You can do this in standing or sitting. Bear in mind, if you're wanting to really work on the spine, you can do it better in sitting. So with the patient in a sitting position, we basically stabilize the pelvis, and we can just get them to side stretch to the side, and if they even want to bring their arm up over their head, that again can be a very nice stretch, and then they can do to the opposite side, again towards me, and stretching, and again you see this stretching and elongation of the erector spinae and the muscles on the side. So these are some very, very basic stretches that we can incorporate into our mobility and stretching regime. Mobility, we would probably carry out the technique, the movement repeatedly, a number of times, maybe 10 times. If a stretch, we would sustain it from anything from 30 seconds to 2 minutes. Again, they're very, very basic stretching exercises. They're pretty much added in after we've done everything else.